Hi, I'm Ute Saint Jean from Montreal, and in today's Yoga Tune-Up Terrible Pulse session, we will massage out some of our main hip stabilizers, particularly the piriformis, the gluteus maximus, and then the IT band. And we picked them because we teach lots of Pilates and spinning and yoga, all with external rotation and hip extension and hip flexion. So these muscles are tight and they could use some tension relief. To understand how to position the balls, let's go over some of our bony landmarks. Find the bone sticking out in the front of your hip. That's the anterior superior iliac spine, or the ASIS. From there, we're going to roll along the iliac crest of the pelvis to the opposite side, and we find the sacrum. The sacrum is a triangle bone at the end of your spine, and between the sacrum and the pelvis we have the ilio-sacral joint. Then we move on to the thigh. Stick out the thigh and find this bony area here. That's what we call the greater trochanter of the femur. So the muscles we work on, they either insert or originate in one of these points, and that's why it's interesting to know them. Let's get started. Lie in supine on your mat, that means on your back, and place the foot soles solid on the floor. Then take your yoga tune-up balls and place them in the ilio-sacral joint. That's where my piriformis originates, at the S1 to S4, and then it runs to the greater trochanter. So from here we are going to move with the fibers of the muscle and glide from side to side, called stripping. Now we cannot really isolate the piriformis. We will get the other gluteal muscles as well because they overlay each other. Now from time to time I have to reposition the ball because they simply roll out of place. We start with the stripping to warm up the muscle, to stretch and lengthen the fibers, and to separate them from one another. And then I move on to a cross fiber action. So I'm going to go up and down, move along, move across the fibers against the grain of the muscle, break up some adhesions and maybe some scar tissues, and draw more blood circulation into the area. Now from here I will move on with only one more. I put one apart, aside, and the other one right back into my ilio-sacral joint. And then I hold the position. This is called sustained compression. And when I be able to tolerate it a little bit, then I will drop my knee. And again, get used to this deep penetration. And then I will roll along from the origin to the insertion of the piriformis. So I go from the sacrum to the greater trochanter, at least I try. Now the piriformis is responsible for external rotation. So often it gets tight. In Pilates we do a lot of movements with external rotation. And then from here I'm going to use a technique called pin and stretch. So I'm going to move the knee up and bring it back down. Now remember that during all of these exercises you have to breathe. Draw the breath deep into your belly and then exhale and let the tension go. And then from here, another pin and stretch. I'm going to go to hip and knee extension and external rotation. Now, and if you feel a little bit of a tingling in your leg, that might be just your sciatic nerve saying hello, because it runs right behind. And if it's too much, then you can either use two balls or place a yoga block under the other side to lessen the penetration. Now I'm going to go back to my two balls and I'm working a little bit more on my gluteus maximus, a big hip extensor and external rotator. So I place the balls right in the center of my gluteus maximus. This is a huge muscle. It covers almost all the butt, and I'm moving to a circular motion to cover more of the fibers. My gluteus maximus And again, I have to reposition the balls. My gluteus maximus originates at the sacrum and at the coccyx and a few fibers at the ilium, and then it runs and inserts into the iliotibial tract or the IT band. So I'm going to reposition the balls, and then I'm going to use a technique called PNF, or proprioceptive neuromuscular facilitation. It means contract and relax. But first, draw your breath deep into the belly and relax your body. And with the exhalation, let your tension go. Then inhale, contract. And exhale, relax. Inhale, contract. And exhale, relax. This gives me even a deeper penetration. And I can stay closer to my knot, break up the knots, break up adhesions, and just hydrate the muscle and the fascia, increase the blood circulation, and release the tension. And now I'm ready to move on to my IT bend. So I'm going to go back to my ASIS, and then from here I move about half an inch back and 1 inch down, and this is the origin of my tensor fascia latae. The tensor fascia latae is a muscle what inserts into the iliotibial tract, and then the IT band goes all the way down to the tibia, and it's a big hip flexor. To prepare it a little bit, I'm going to use a technique called skin rolling. So I'm going to take my ball, place it right there at my origin, and first again I do sustained compression because it's sore and I want to get used to this penetration. Whew. Now ideally skin rolling is done directly on your naked skin, but I didn't want to strip in front of the camera, so we're going to do it through the exercise clothes. Now I take my ball and I sort of twist it all along the ilium, and I come all the way to the ASIS, and right there I'm going to get a few of the fibers of the sartorius, what is also a big hip flexor, and he is happy to get some of the action. I'm going to hydrate the fascia and mobilize the so-called uptown joint. And now I'm ready to move on to roll out my IT band. But one ball will give me way too much penetration and therefore way too much pain. So I'm going to use 2 balls for the IT band, and I'm going to leave them in the tote bag so they don't come apart. So take your 2 balls and place them at the origin. Then take the other leg, place it either behind or in front as a support leg. And now we're going to roll the balls along the IT band all the way down and try to get to the knee. It's sensitive and sore. So this is a little tricky because you kind of have to pull your whole body along the floor and roll out this IT band. That feels good. So now you remember, we only did the exercises on the left side. So if you want to complete the sequence, you got to repeat everything on the right side. See you next time.